I just found out that I have a lesion on my brain and demyelination, I don't know if I'm saying that right, disease, which the most common type is multiple sclerosis. We don't know yet what official type it is. I have to go back for more testing to figure it out. But all that to say that I would have never found this out if I hadn't have advocated for myself so hard. Let me backtrack a little bit. So I've had migraines since I was 8 years old. The last time I had a brain MRI was in 2005 when I first started getting migraines, and they thought I could have a sister tumor in my brain, and my brain looked normal, so they just decided that it was migraines. Those migraines have continued on and off my whole life, never really completely off, but the symptoms have changed slightly. The way my migraines manifested have changed slightly. And in the past year, 2 years, I started getting a lot of new symptoms or different symptoms that they just classified as different types of migraines, including like consistent numbness in my hands on and off and a consistent feeling of dizziness. We also thought that it could be possibly POTS because I have hypermobility and I'm in the process of getting diagnosed for hypermobile Ehlers-Danlos syndrome, which also has a 3-year wait list that I'm on right now, by the way, to get in with genetics. That's a whole other thing. But I had a lot of other health things going on, and fortunately I have a wonderful primary care physician that when I went in June and told her all these new health issues that I finally felt like I was ready to address, she got me referred to so many different specialists, including an ENT for one of them, because I was having chronic allergies and sinus infections that were very severe for the past 3 or 4 years. So I went to the ENT and she looked at my nose. She couldn't see anything really going on the outside. So we thought maybe it's allergies. I'm scheduled to go to the allergist later in August, but haven't had a chance to go yet. That was the first time I could get in with them. But we decided we were going to go on a nose spray that is, one is an allergy nose spray and the other is fluticasone or a steroid, as well as twice daily nasal rinses. After doing that for a month, I went back to her. I was still having pretty significant nasal drip. She decided to do a CT of my sinuses. They found swelling here and nowhere else, which was consistent with something she said that's called idiopathic intracranial hypertension, which is basically where you have too much cerebral spinal fluid outside your brain that's putting pressure on your brain. They don't really know why this happens. That's why it's called idiopathic. They think it could be because your brain's not absorbing spinal fluid correctly. But then that led to them thinking that I could possibly have what's called a CSF leak, which is where you have so much pressure building up in your brain that then it starts to it breaks through the membrane and starts to leak through your eyes, your nose, or your ears. So I got testing done of the nasal fluid coming out of my nose because we thought that that might be what it was. But then I also got in a car accident and I haven't had transportation. I've been dependent on my partner's car and they go to work every day, so it's seriously limited my ability to go to doctor's appointments, which means I haven't been able to take back this cup of my nasal fluid back to be tested. And too much time passed, so now I need to get another one so that I can collect fluid again. It's a whole thing. But actually, I need to rewind even further because when my ENT first called me about this, she was like, you haven't had an MRI in a really long time. You need to contact your neurologist and you should get an MRI to make sure that there's nothing else going on here, to ensure, to also look to see if there's swelling from idiopathic intracranial hypertension on your optic nerves, because this can cause blindness. You also need to go to the eye doctor to see if you have that swelling. It's called papilledema. Again, it's a whole thing. So I reach out to my neurologist. My neurologist is like, I don't think you need an MRI. Unless you have papilledema and you go to the eye doctor, there's no reason. And I was like, I think that's actually really irresponsible considering that we know I may have a connective tissue disorder, which means that I'm more likely to have a lot of other brain stuff happening that could also be the cause for this, which could be more serious issues, not just just because I don't necessarily have papilledema because I didn't think I did, doesn't mean that this doesn't warrant more testing. And she was like, okay, fine. I didn't realize you were having other symptoms. But she really pushed back on me at first. And it was from the MRI that I just got the call saying they found lesions on my brain and that I need to have another one with contrast. And to add even more fuel to the fire, I went to the optometrist, but the optometrist said that it was inconclusive, the result of my dilated eye exam, because they had images of swelling happening on my optic nerve both from 2 years ago that looked very similar to how it looks today, which means that I have likely had this swelling for a long time. He said it could be a genetic defect, or it could be prolonged swelling. But because I am so used to these migraine symptoms and what I was told by my neurologist were becoming daily chronic migraine, I didn't realize that I was actually having effects happening to my vision because I just kept associating them with migraines. So the optometrist was like, since this is inconclusive, you need to go to the ophthalmologist to get an OCT scan. But again, same problem. I don't really have transportation right now. So I was waiting until I could get my car in to get fixed because it cost me $2,000 to get it fixed so that I have reliable transportation to go get this testing done by the ophthalmologist. But regardless, like, that testing is really just going to help us identify, I think, which type of demyelination disease this is. But either way, this is like a really big deal. This is not like a mild diagnosis, because regardless of what the cause is, this ultimately means that the neurons, like the myelin sheath around my neurons, has been damaged in some way, and that I have neurological damage. And the whole thing just makes me so fucking upset, because, like, can you imagine if I hadn't pushed for that MRI? If I just kept living my life with numbness and muscle tremors and spasms and blurry vision and blind spots in my vision and constantly feeling like I'm like the room's spinning and tinnitus, like, if I just kept living my life thinking that that was normal, I just had anxiety. If regardless of what the cause is, whatever disease this is, it's really important to figure it out, because there are some that are treatable, that people can be, like, see full improvement from. There are also several that can't, but still it's important, like MS, to get diagnosed, because there are things that they can do to prevent it from progressing as quickly. But regardless, obviously I'm trying to prevent myself from going down too deep of a spiral until I have more information. But mainly what I just feel is just anger. I'm just angry that it took me pushing so hard to find this. And this is nothing I expected. I expected to maybe find like a Chiari malformation in my brain because of the hypermobility. It's comorbid with that often. Or I don't know. I don't know what I was expecting, but I didn't expect this. And this is not an uncommon story. If you are a woman or someone who is assigned female at birth, this is a common story for you, where doctors don't listen to you, you're gaslit. It takes years to get diagnosed with the same thing that a man could get diagnosed with, just because your pain's not taken seriously, even by other doctors that are women or nurse practitioners that are women. And add on top of that, if you're already disabled with something else, one, how difficult it is to try to navigate the healthcare system by yourself, but they also judge you even more if you're disabled, especially if you have cognitive disability or neurological or developmental disability like I do. And also if you're a person of color or Black especially, like your rate of diagnosis and misdiagnosis is even longer. And it's just like, what the fuck are we doing? You know? I shouldn't have to basically take on the full-time job of going to doctor's appointments and managing seeing all these specialists just to get a diagnosis for something, or for the tests to be run for them to actually see something. And the worst part of it is the whole time this was happening, I was gaslighting myself, saying like, it's gonna be so funny when I get this MRI and it comes back totally clear, but I'm still gonna be happy I asked for it just for my peace of mind. And then I get the email with this information, and it's just like, I'm wanting answers, and I'm mentally prepared for some things, some chronic illnesses, but I just keep getting diagnoses that I wasn't prepared for, that I didn't expect, and that are also so much worse than the ones I was expecting. And I just wonder, how long have I had this? How long has this been happening, that I've been living with this, that it's so normal for me that I don't even necessarily notice these symptoms anymore? What if I hadn't have asked? No one should have to go through this. No one should have to do this to get the care that they need, and it sucks. It sucks.